Hi, everyone. This is Stephanie Baker, Communications Director for Celeste Williams for Arkansas. We're here tonight to do a live Facebook chat with Representative Denise Garner. She's the representative from District 84 in Fayetteville. She's also a retired nurse practitioner. Celeste Williams is the Democratic candidate for U.S. Congress here in Arkansas's 3rd District and also a family nurse practitioner. Thank you guys for joining us tonight.
Glad to be here.
Thank you so much.
You're welcome. So tonight we're going to talk about the current COVID-19 pandemic and how that's affecting our healthcare system and our healthcare professionals, as well as address any questions from the audience. So any viewers, if you have questions, feel free to drop them in the comments on this post, and we will get to them as time allows. So first, Celeste, as a family nurse practitioner, can you tell the viewers what you're seeing right now in your practice, what you're hearing from fellow healthcare professionals who are on the front lines, and are your fellow healthcare providers, are they concerned about these increasing COVID numbers that we're seeing?
So there is a lot of concern about the increase in specifically Benton and Washington County. You know, a lot of my fellow healthcare providers are certainly quite concerned about how we're going to be able to meet the needs of healthcare that will be present with this increased number of COVID cases, increasing hospitalization. You know, these are not easy patients to care for when they're super sick like they get. You know, what I hear from nurses within the hospital is a deep concern about balancing the onslaught of COVID patients with the everyday demands of healthcare. You know, hospitals operate on very thin margins. There's generally not a whole lot of open beds in a facility on a normal day. And so when you add that to COVID, it's a real mess looking at staffing needs as well as having enough resources to be able to care for the additional patients that are in the hospital. So I would say that's probably the biggest thing that I'm hearing about right now.
Thank you, Celeste. Denise, you are a retired nurse practitioner, and you happen to have an epidemiologist and a physician also in your immediate family. What are you seeing, and what's most concerning to you and those around you?
You know, I think the biggest concern is just the lack of reliable information and the slow response once we get that information. You know, especially from the federal level, I think that there's a lack of clarity in the communication. I think that folks have not provided the information to educate people about the severity and the devastating potential for the virus. And, you know, then they're not practicing in the modeling of preventive behaviors. So the messages that are coming out, especially at the federal level, and I think some at the state too, is just confusing. We're getting mixed messages and folks don't know what to do. I think people are more than willing to do their to do their best to mitigate the virus spread, but they don't know what that is. And that's my biggest concern, is just that we're not getting accurate information. We're not getting consistent messaging, and we're not reacting to that messaging as quickly as we need to.
Yeah. That leads me into my next point, Denise. So as our campaign has noticed the last several weeks, I'm sure you're noticing this as well, we're getting lots of questions from healthcare providers even, who are wanting clarification about what the CARES Act did, about the CARES Act funding allocation. Right. As a state legislator, can you provide some clarification on that? Like, who is eligible for that money, for those stipends,
Sure.
And when will it be allocated?
Sure. And the second part is a tough question because, you know, it's very difficult to plan for a pandemic in the middle of a pandemic. So a lot of these plans have been implemented while we're trying to stop the spread, to flatten that curve. And so there have been multiple issues from the federal side and from the state side about getting that money out. But the CARES Act the CARES Act money that went into a state steering committee or a state fund, that we have a steering committee that's allocating those funds or helping to figure out how to allocate. And then the legislative council, the Arkansas Legislative Council, will okay that. So we have the governor's steering committee that is determining how those funds need to be divvied up, and then the legislative council will be the one to make sure to allocate the funds to do that. So the CARES Act, the CARES Act money that we got for the state was determined. The governor determined that he really wanted to make sure that direct care workers in the hospital and long-term care facilities got some extra hazard pay, if you will. And so that includes RNs, LPNs, nursing assistants, the medical and dental providers, interns and residents, the radiation technologists, the OT, PT, lab techs, respiratory therapy, any of those folks that are on the front line in the hospitals or in the long-term care units. So physical therapy or occupational therapy, or whoever's going into the nursing homes, and even the developmental sites for adults with disabilities. So those are the folks that get kind of that first round of money. Then there's also those providers for the continuity of care in those facilities. So the other folks that are eligible are pharmacists, the janitorial staff, the folks that are keeping the hospitals clean, dietary, the intake folks, all of those frontline healthcare workers should be getting those funds. Now, the biggest issue, I will say that in that first round of monies, the EMTs and ambulance drivers and those services were left out. And so we did go back and make sure that there was some money allocated for those folks as well. The biggest issue is that every one of those healthcare workers at the front lines, those monies are going directly to the hospitals or directly to the agencies that hire them. And so that adds kind of another system that slows everything down. So it was slowed down from the federal level. We didn't get the money in the time that was hoped for. And then in changing all of our software and updating software and hardware, that money was slow to get to the hospitals. But I think that everything except for the newest, and we should get a report in July of the allocation of funds, but it just isn't available quite yet. But we should have those allocations of funds in July, and I can get one that's up to date then. But everything should be out to the hospitals and to the other facilities, the contract facilities, except for the EMTs and the ambulance services. That was just allocated this last week, and just okayed by ALC, and so those will be coming out soon.
Okay, thank you. Celeste, as our future Congresswoman, can you talk about where the CARES Act has fallen short? And if you were our representative, what would you be doing differently? What do you think the people of District 3 need most right now from their federal representative?
So where I see that it fell short, and I was pretty optimistic at the beginning that we had learned lessons from previous legislation that had been passed, was making sure that we were helping everyday people who have been hurt by the economy decline. And so, I don't think that what we did was enough. I have been disappointed to see a lack of transparency and accountability from the administration in who is getting those funds and the process at which they're being given out. I certainly don't want to see large billion-dollar industries like cruise lines and such getting a bailout when I'm worried about my neighbor not being able to pay their mortgage and losing their home. And I think that really making sure that Washington is centering the needs of everyday Americans in their policy and any future legislation is lacking and is incredibly important. So that was kind of where I would start with that. I also think that there has been a lack in a federal plan that really helps address the COVID virus. There seems to be this false narrative that we have to choose either protecting the health of our community versus maintaining the economy. And the reality is if we do not deal with this virus, then the consequences are much deeper and longer in our economic harm that people are experiencing. People can't pay their bills if they don't have a job. And so, we put everybody on hold at the beginning of this and gave everybody $1,200. And we didn't get the testing in place.
Right.
We didn't use the federal government to bring down to negotiate for PPE for nurses, to make sure that we are providing the most safe place possible for people that we've deemed essential workers. And, we owe a lot to the people who are still working right now at much greater risk to themselves and their family members. And we're not protecting them. And I think that, I don't think history will look back kindly on the way that the United States has handled this. And I find it heartbreaking to watch other countries who have dealt with this in a much more proactive manner and are reopening their economy now because they can. And this is the United States of America. And we're not dealing with this like an industrialized nation. And that, I think, is one of the hardest things for a lot of us to swallow, that I truly believe this is one of the best places in the world to live, but we're not acting like it. And we are not really valuing and caring for the people in this country. And it's not the economy that makes America great. It's the people who live here. And that has been really hard for me to watch.
Thank you, Celeste. In that same vein, one of our commenters is asking, and I think I'm going to direct this question to Denise since she's a state legislator, and this is a tough one to answer, but do you agree that our governor here in Arkansas has handled this situation appropriately?
We've had lots of talks. Governor Hutchinson knows exactly where I stand. I thought at first he did a fairly good job of listening to Dr. Smith and the healthcare team. I thought he, was really looking at the data and doing the things that we needed to do. One of the things that Celeste mentioned, and I think it's true in the state as well as it is in the nation, is that we had some lag time. We had some time where we didn't have the hot spots like New York had. We should have been learning from them and preparing for the times that we would have those higher numbers. And I don't think we did that well. And I don't think that it's all of the state's fault by any means. I think that a lot of the procurement issues from the very beginning, trying to get PPE, trying to get tests, all of those things were very difficult because of the way the federal government mandated that the governors be bidding against each other. That's ridiculous. And so there were some things that were inherently very difficult, but we didn't take that time to plan. And I think that we should have been doing education campaigns. We should have been hiring contact tracers. We should have been making sure that the testing sites were up and the logistics of those were ready to go. So here we are when we are now back into a hot spot, when some people are having their second wave. We're just having our first wave, and we have the same issues that our federal government did is that we haven't learned from anyone else. And so, I'm still dealing with people who have not received their stimulus checks, have not received unemployment or PPP. All of those things we knew were coming, but we just haven't planned. And I know how difficult it is to plan while you're in the middle of an epidemic. That's very difficult, which is why the federal government shouldn't have disbanded the pandemic task force. All of those things, could have been working with the WHO from the very beginning, who already had tests that were available. We should have been doing a lot of these things that federally, because of those federal issues, became big issues in our state. I have written op-eds. I have written letters to the governor. I've shared on Facebook. He knows how I feel. And of course, coming from a family of public health and physicians and attorney physician, I'm dealing I'm hearing about not only the public health side of some of these issues, but also the legal and the ethical side. And so, it's very frustrating that we didn't plan the way we should have. I think we should have shut down, because I think the messaging that is sent out when numbers are getting higher and you open up, most people think that if we're opening up, everything's okay and they can just go back to normal. So it's not necessarily what he did. I think he shut down a lot of businesses that, or a lot of businesses and organizations that maybe some of the other states who were technically shut down didn't shut down. But I think the messaging of not shutting down, of not making sure that Arkansans understand the devastation that this disease can cause, has made it very difficult to go back now and say that we've got to social distance and we've got to wear a mask. And we've just gotten too many mixed messages. So it's not what he's done, but how he's done it, and the fact that he's been slow to do it. Those of us who have been in nursing, have been in public health, realize that you give a patient an antibiotic or an antidepressant, and it takes a while before that comes into effect. Well, public health is the same way. Your mitigation techniques, or your whatever resources that you put into place, strategies that you put into place, don't work until 10 days or 2 weeks down the road. So you have to think forward and not backwards. We're starting some of these mitigation procedures way too late. And so, that's been the most difficult thing in the state. One of the other things is that I've heard both the federal government and the state government, including the governor, say that this disease is not predictable. And we know from the research that's out there, it's very predictable. We know exactly what it's going to do, exactly how it's transmitted, exactly what we need to do to keep that from happening. Now, it's unpredictable in the places that it may spread if we don't have the contact tracing or the testing that we need to know where those clusters are. But the disease itself is very predictable. We do know, and if we look at the research and if we look at what's happened in other countries and other places, we know exactly what to do. We're just not doing it.
Mm-hmm. I think a lot of people were concerned about the changing recommendations from like the CDC as an example. And part of that is that we didn't have a lot of science to back that up, because it was a new virus to back up recommendations. But now that we've learned more, we have better information to make decisions on. And what I find concerning is that, if you want to be a leader, you have to make some really hard decisions sometimes, and they're not always super popular. Well, there's evidence to show that using a mask reduces the transmission of COVID. And so we can talk about encouraging individuals to make better choices, just like we encourage individuals not to drink and drive and stuff like that, but
Right.
it's not enough. And so we have to take a step farther and mandate that, in my opinion.
Yeah.
And, it doesn't need to be for every single place, but in public spaces, we know that we can reduce the transmission of the COVID virus by using a mask. And, we don't have to get to 100% compliance. That should be a goal. But there's some pretty sound evidence that if we get to at least 80% adoption, we're going to really slow this virus. And we're not going to see that for a couple of weeks because, as we know, you get it. And then it's a couple of weeks before you have symptoms, and people will get the virus. And some may be asymptomatic, but a lot are pre-symptomatic. And we know with so many other viruses as well, that you have that increased viral load that before you have symptoms, you are already spreading the virus.
Right.
And that's not new science. That's old. We know that.
Yeah.
And we need to make sure that we are utilizing the data and the knowledge that we have so that our decisions are made based on science and data.
Right.
So that we can keep as many people safe and healthy as possible, and make sure that we are protecting our economy as well. We don't all have to stay home and completely close off the economy if we're all willing to wear a mask, wash our hands, and watch our distance.
Right. Exactly.
Yeah. We have a few more audience questions I'd like to get to from our viewers. One is asking if there are resources for smaller rural towns that are losing turnback dollars and are having fewer jobs.
Who do you want
Denise?
to take that question?
Well, I'm thinking that's a Denise question. It sounds like
Okay.
a state legislator question.
Well, it certainly is something that we're all looking at. One of the things that's happened with the COVID-19 virus is that it's highlighted the issues that people are facing in poverty and in rural settings, and so those kinds of issues have certainly been brought to the forefront. It's something that we're making sure that we're getting rural hospitals, rural healthcare. We have changed so that we can get telemedicine. We've done some emergency types of procedures to make sure that we're hearing from that group of folks and making sure that they understand as well, because this is not as an urban or a rural. It does spread quicker, obviously, in places that have high density population, but it's happening everywhere, and we've got to make sure that broadband. That's another thing that we're working on right now, is to try to expand the broadband services. But we figured out pretty quickly that access to healthcare is a huge deficit in some of these areas, that access to education, certainly without broadband, is a huge issue. And that just the rural hospitals, those are the heart and soul. The schools and the hospitals are the heart and soul of rural communities. And we've got to make sure that those hospitals are functioning the way they need to. So we have had some monies allocated to those areas, and we are making sure that everyone in the state has access, and it's not just, in fact, Arkansas is mostly rural. When you talk about Little Rock, maybe is a city, and even though we say Fayetteville's a city, the region probably would count as a city in most other states, but we really are a rural state, and we have rural issues. My district includes Greenland and Elkins and Farmington and Prairie Grove and West Fork, and so I've got a lot of Washington County areas that have a lot of difficulty with access, even 20 minutes away. In some aspects 5 or 10 minutes away from Fayetteville. And so that is a concern. It's something that I think has been highlighted by the virus, and it's something that we'll continue to look at and work on.
When you guys were speaking earlier about who was eligible for CARES funding, we had a question come through that was wondering specifically about that funding allocation. I think you mentioned that it goes to hospital settings and long-term care facilities. Their question was, why is it not going to nurses who are in clinics and swabbing patients or screening for symptoms and that sort of thing? Celeste, do you have a guess as to why they weren't included in that funding allocation?
So I think they should have been. I think anybody who's being impacted directly with caring for people with COVID should. And I don't have an answer as to why that hasn't happened for everybody. Like my husband works in the emergency department. He's not getting it. I work in a clinic doing family practice. We're not getting it. So,
Yeah, I say the same thing. My husband and son are both oncologists. Cancer didn't stop because of COVID.
Right.
And so they didn't stop treating, and, they had to purchase PPE, and they had to make alterations in the way they cared for their patients, had to hire extra cleaning, all of those kinds of things. And they're nurses and radiation technologists, and they did not get it either. So, and it's something, again, that highlights, I think, again, some of these kinds of things highlight the needs that are out there that we don't remember sometimes in policy. And so we've got to take good notes. I'm trying to keep every piece of data that I can, so that when we do meet in the legislature next January, we'll have the data to show that these disparities in healthcare, these disparities in income, these disparities in education make a huge difference in the way people access their needs and the way they're able to live during a pandemic. And so those kinds of things we have got to make sure we look at again, and sometimes for the first time in the legislature in January.
I also think that it highlights our need to have legislators in office who understand not only the struggles of everyday Americans, but also understand public health, and who understand how the healthcare system works. And, I am so grateful that we have a nurse in our state legislature to advocate for us. And I think that's another thing that nurses really do, is we advocate for the needs of our patients. And as a legislator, in Washington, I intend to advocate for the needs of my state and the communities that are in the district I serve. And I think that it is blatantly obvious that we have a lack of that at the federal level in leadership.
Yeah. And one of the things that I've learned is how important it is to be able to collaborate with your federal representatives. Our congressional legislation, our congressional officers and Arkansas's delegation, it's difficult to deal with them sometimes because they don't understand that kind of thing. But, and Celeste and I've talked about this before, but nurses are trained to listen, to observe, to research, to collaborate, to plan, and to advocate. We're taught to empathize and educate and encourage, and then reassess the situation that's going on and start the process all over again. We're trained to do that. That's what we do. And I've tried to do that, whether I was a floor nurse or a clinical specialist or, in the Cancer Institute. Everything I've done, I've tried to make sure that I process whatever we're doing in that way. And, in doing those kinds of things, you become empathetic and you become a good listener, and you become the person that the patient, or in this case now my constituents, um, feel free to talk to. And that's so important. And that rapport that you build with your patient or your constituency is so important. And that collaboration, that collaborative thought process that all nurses, I think, has helped in the legislature to get things done, and it helps. And I think it would be amazing to have one of our, or two of our, or three or four of our congressional delegation who we could work with like that, who really had a collaborative relationship. Mm-hmm. And I don't feel that's the case now. So we're ready.
And to collaborate with people who don't see the world the exact same way that you do.
Exactly.
You know,
exactly.
And I think that's another thing that we're used to doing. You have to work as a team and get along with everybody. And I don't care if somebody's a Republican, a Democrat, or an independent, or something else. I don't care. We are all here to try to make the lives of the constituents in our districts better. And if we work together, we can really meet those needs.
Yeah. My job, one of my first jobs was working in the Cancer Institute with smoking cessation. And, it's one of those things, and we deal with these kinds of things every day. You want people to do the right thing, but sometimes they don't, what the best thing for their health. And sometimes they just don't. And you can't judge, and you can't, you have to look at the situation and try to figure out commonalities, common goals, and make those things happen. And the legislature is no different than the healthcare system. So, I mean, we've got to do that more. And it shouldn't matter. And this is one of the things that Celeste and I've talked about, is that it shouldn't matter, and it doesn't matter whether the idea is a Republican idea or a Democratic idea. If it's a good idea, it's one that we need to adopt. And, the best way to make those ideas come to fruition is to make sure we have everybody at the table, and make sure that you have different ideas and different situations. And so I think that it's really important to deal with Republicans and Democrats and independents and libertarians, and we've got to deal with everybody and sit down and find common goals and make those happen. And you have experience doing that as a nurse, as a mother, in the foster care system. And so, so those things are important, and those are the qualities that I know you possess that would be indispensable in the congressional setting.
Thank you.
So we are going way over our usual time.
I knew Denise and I were going to go over.
I knew. We need to have a whole hour for you two to talk. Oh, I think we just lost Denise. Maybe she'll come back and join us. But I know if she comes back, we'll let her back into the conversation. We'll see if she joins us again. We have so many questions coming in. This is obviously a topic that people really need to know about. And I think Denise is back. Let me see if I can get her back in the stream. I think her camera needs adjusting again.
Here we go.
We can almost see you. Hey, you're back. Hi.
Yeah, sorry about that.
No, that's okay. I was just telling everyone that, this topic is obviously striking a chord with everyone who's viewing. There are lots of questions. We're not going to have time to get to all of them. We probably need to do this again sometime soon, because people have so many questions. And for those of you who are commenting and we're not getting to your questions, we'll do our best to go back and answer those with a comment to reply to you. I want us to end with your recommendations for what people can do from two different perspectives. One, as a healthcare provider, talking about keeping their families safe, their community safe. What are your number one recommendations? And also from an advocacy perspective, what should they be doing? How should they be talking to their legislators, talking to their friends to advocate for better for our district right now. Denise, we'll start with you, and then Celeste will let you close us out.
Well, I think that the first thing is to find credible sources of information, to make sure that we're checking all of our sources, make sure that they're coming from places other than political sites. I listen to NPR and BBC. I make sure that I check with the CDC and the WHO. I check with Johns Hopkins has a great site. There's lots of medical sites that are really good. For the state, I post every day the governor's press conference, and on the weekends when he doesn't have a press conference, I make sure that our COVID numbers are there. I also update on the CARES Act and anything that we're doing statewide. So working on education right now. So those kinds of things are also posted. You're welcome to check that out. Denise Garner for Arkansas on Facebook. Arkansas COVID is a great resource on Twitter. Missy Orpin is a journalist who's kind of made COVID her passion right now, and she's spending most of her life doing that. So that's a great source. But find good sources. Make sure that we're finding the best guidance and then follow that. Most of the universal, we talked a little bit earlier about universal guidance, stay home if you're sick. Make sure that you're physically distancing. That's different than socially distancing. Make sure that you're physically distancing, but stay active socially on Zoom or however, Facebook. Make sure that you're using good hand hygiene, and make sure that you're wearing a mask. That's something that working on several different groups now to make sure that message gets out. That masks work. They help you from being from getting sick, and then it also helps you from spreading the disease, helps others from you spreading the disease. The other thing that I just want to kind of leave you with, and this is something that I talk about a lot, but it's something that I think we all need to think about, and that is, if a medically informed response to this pandemic creates an economic hardship that's so serious that its ramifications are worse than the ramifications of the virus itself, then we need to be re-examining our social structure to figure out why that is. That's ridiculous. We are condemning some to die.
Yes.
And in general, it's those who are stuck in an engineered poverty, so that of a preventable disease, no less, just so that we can maintain an ineffective for all economic system. So I think that's something we need to think about, the underlying factors, not just for the COVID disease, but for our economic disease, and how we deal with that. And,
absolutely.
Yeah, and I just want to say that the thing that I think is most advantageous for us to advocate for is better leadership. And I think that I'm blessed in that I don't have an opponent. So for this next election, so my goal is to make sure that I'm doing everything I can do to help the leaders, the candidates that I feel like will be the best leaders for local government, for state government, and certainly for our federal government. So if you don't take anything else away from here, please take a look at the candidates. Make sure you're aware of what's happening in as far as gerrymandering, as far as ballot initiatives. There are a lot of things, and then find those leaders, those candidates that will be good leaders, and do everything you can do to help them. And I hope your number one choice will be Celeste Williams for Congress.
Thank you. Well, I will follow that with one. I want to say thank you so much for joining me for this conversation, Denise. I really appreciate you and your mentorship and all of the work that you do. I think that sometimes we forget that democracy is participatory in order for it to flourish and thrive. And we spend a lot of time thinking about our leaders, and I don't even always like to use that term leaders, but our public servants. But we as citizens have a very active role that we can play in democracy. And we have to put pressure to get what we want at all levels of government. And that can be contacting your mayor and asking for them to enact a citywide effort to enforce mask wearing. It can be calling your state legislator and your state senator. And we should all know who those people are. I mean, I still contact my state legislator and my state senator, probably my senator more than my state legislator, but because they have such an active role that they can play to help meet the needs of our communities. And we are in a crisis right now. And it is not enough for us to stay at home and be frightened. We have to really work to make sure that we are advocating for better. So I think those are things that we can do. I think a lot of times that this whole pandemic feels so hopeless. And I think we all feel a great amount of despair at times watching how problems are not being addressed. And I continue to say that hope is not just a feeling, but it is an action. And so even when we don't feel terribly hopeful, we can use our voice and really advocate for our elected officials to do better. And that's going to require them to be in a difficult position sometimes and to mandate things that are not always super popular, that they may get a lot of political blowback for. And I personally don't care if I were not elected again, if I make a decision that was the right decision to make. And I think that we have to make sure that we are electing people who are willing to do the right thing, even when it's hard. So I would encourage everybody to contact their local officials and ask for tangible things. And, in this case, the data is clear. Wash your hands, wear a mask, watch your distance. And so that is what we need to be advocating for. So
Thank you both. I appreciate you both doing this. I just want to mention one more time to all of our viewers that we are incredibly over the time that we had set aside for Denise to join us tonight. So I know there are so many questions. I promise we're going to go through and look back at them and reply to you each on the site. I'm also going to, when we're done with this, I'm going to drop all these links that Denise mentioned about reputable sources. I'm also going to drop a link so you can check your voter registration and make sure that you're ready to vote in November. And I'm also seeing a lot of questions about going back to school and worried about education for your kids. On July 9th, we will have our next planned virtual town hall, and that's the topic that we plan to discuss on that day. Not to say that we won't have a surprise pop-up Facebook chat in between now and then, like this one ended up being, but our next planned one is July 9th, and we will focus on going back to school from the perspective of parents and from a legislative perspective and from the perspective of teachers. So I hope you'll all join us then. Denise, Celeste, thank you so much for your time, and thanks to everyone who watched.
Thank you, guys.